In fact, we are achieving an efficiency of more than 10 to 20 times now in terms of number of staff supporting the doctors. I need 20 staff to support 200 virtual clinics. Physically, I need 7 to 10 staff to support one clinic. It makes huge difference. And that supporting one clinic is not even 24/7. Virtually, it's 24/7, round the clock, anywhere, any place in the world.
Hello, you're watching Proactive. I'm joined by Dr. Siaw Tung Yeng. He's co-founder and co-CEO of Mobile Health Network Solutions. Dr. Siaw, very good to meet you. For those new to Mobile Health Network Solutions, could you briefly introduce the company and its mission in digital healthcare?
Thanks, Stephen. Mobile Health Network Solutions is founded on the visions of offering an affordable, accessible 24/7 care globally. We believe from day one that healthcare is equitable, must be equitable, and it is a basic human right. So from day one, we envision a world where we create a platform that connects all the doctors globally to all the patients globally, breaking down barriers in economic, culture, race. And that has remained unchanged since day one.
You recently launched AI Checker. How does this tool improve patient care and move the company closer to its vision of an autonomous AI doctor?
This is something that we are very proud of. It is my vision that eventually the AI doctors will dominate healthcare's landscape. I'm a doctor myself, and it is without doubt that a doctor who doesn't use AI is poorer than a doctor who uses AI. And an AI doctor ultimately can do 95% of the job for doctors. Now, what the AI checker has done, now this is one of the very first in the world. At the end of every consultation made virtually that we have done with our patients, it will point to the doctors where we need to improve. It will grade the doctor according to 5 scale, and the doctor can do it. It's like I have a living mentor beside me who is 100 times more powerful in terms of knowledge base, and it will guide the doctors. Now, imagine the day when we launch the AI doctors, it will elevate the healthcare standard of the world overnight. And we've gleaned from the knowledge of the top 5% of the doctors on our platform globally and improve it day by day. We hope that this milestone will come in the next 1 or 2 years.
Dr. Siaw, the company recently announced a $300 million at-the-market offering. How do you plan to use this capital to support growth and also your global expansion strategy?
I think the first thing is substantial amount of the sum will be poured into development of the AI autonomous agent, not just for the doctors, but for the patients. And I think that's important because it can scale globally. At present, the AI is able to communicate in 54 languages just over the last 6 months. And that will help to equalize healthcare. That's number one. Number two is we come from Singapore. It is an area of vast opportunity in the Asia-Pacific region, accounting for almost 2 billion of the world populations. Now, whatever resources we are actually getting out of the 300 million, a lot will be used for regional expansions, opportunity of acquiring, especially the last mile delivery and logistics in terms of medicine delivery, logistically providing pharmaceutical and laboratory support. And that is crucial. In healthcare, we are able to do most of the things virtually now. As said, the patient will still need the medicine in their house. You know, in countries like Africa, I think we're thinking of even using drone to reach it out to the remote, inaccessible area. I think this is not far-fetched because it's already happening at this point in time. And we are very excited of what is to come, in fact.
In your half-year results, you spoke about moving to a leaner asset-light model. How's this shift helping you scale and move towards profitability?
So I think one is very important is what we're building is a huge platform. Number one, as I mentioned, the scaling is so much easier now because the model is multilingual. In the coming 2 years, we think it can speak all the major languages of the world. Number two, virtually a lot of things can be done. Healthcare, 85% of it can be delivered virtually. And that's how we propose. Only 15% need to be physically face-to-face by our doctors, you see. So, in fact, we believe that the day is we don't need many clinics physically. That's for the last mile touch point. But most of it should be done virtually to scale. And take what is happening in our platform now. Not only that, technologically, because it's so advanced, it is highly effective and efficient because there will be so much automation within the platform. You don't need so many manpowers to carry out a lot of functionalities. In fact, we are achieving an efficiency of more than 10 to 20 times now in terms of number of staff supporting the doctors. I need 20 staff to support 200 virtual clinics. Physically, I need 7 to 10 staff to support one clinic. It makes huge difference. And that supporting one clinic is not even 24/7. Virtually, it's 24/7, round the clock, anywhere, any place in the world.
With recent initiatives such as the LifePack acquisition in Indonesia and the rollout of AI-led solutions, what milestones should your investors watch out for over the next 12 to 18 months?
I think it is critical for the investors to see a few things. Number one, the rolling out of our AI agents to the patients to make healthcare simple, highly accessible, and scalable. You will see in the coming weeks and months the capability of the AI agent for the patient, for the doctors as you go. We are in the forefront of this as number one. Number two, look at our acquisition target. They are there to serve the healthcare needs of the people around the countries in terms of what we are acquiring, you see. It is important to see what we are acquiring or how we're bringing into the M&A. LifePack is a pharmaceutical aggregator with 1,000 almost points of deliveries around the whole archipelago of Indonesia islands. And that is important. Now, a lot of these things done with a lot of thoughts, intents, and purposes to make sure that healthcare is easily accessible, affordable virtually, and 24/7 round the clock. The other thing is look at the number of the doctors network that we're building. We are building the largest doctor network, not just coming out of APEC, potentially anywhere in the world. Just 2 weeks ago, just within one continuous medication, I'm able to talk to 1,000 doctors just at one session across the island of Indonesia. Now, this is important because the huge network of doctors will support each other, exchanges of knowledge, supporting the massive number of doctors and patients around the world. Now, there is enough doctors, but it is not equally distributed. We are trying to equalize that. I think these 3 points, the number of doctors in the network, the intents and purposes of our acquisition target, that's important. And the amazing thing that what our AI agent is able to do is distinctly different from the rest.
Well, I hope you'll continue to keep us updated with your progress. Thank you very much for the introduction today.
Yeah, wonderful. Thanks a lot, Stephen.
You're very welcome. Dr. Siaw Tung Yeng, co-founder and co-CEO of Mobile Health Network Solutions.